Riverside Walter Reed Hospital postponed elective surgeries due to the coronavirus 6 weeks ago due to the governor's mandate for postponement to assist with social distancing and to protect personal protective equipment here at the hospital and for patients in the community. As we progress forward with elective surgeries here at Walter Reed, we have enough protective equipment for our staff and our patients. Walter Reed Hospital has been very busy over the past few weeks during the coronavirus. We have kept the emergency room open for patients who need care, emergent care, and anyone who comes through the emergency room can still be treated for their urgent or emergent surgical issues, problems, through our emergency room. So we have been doing orthopedic cases, general surgery cases, life-saving surgeries, vascular or limb-saving surgeries as well, all during the time of the virus. As we start elective surgeries here at Walter Reed, we are going to use a number of algorithms and guidelines from the government and from surgical societies to determine who is fit to have their elective procedure done, organize them, and then you will be called at the house if you meet the criteria to have an elective procedure. For my patients, and I assume for other surgeons, I specifically review your case, review it with the guidelines, and then determine if you are safe to have the procedure done at this time. So when you come to the hospital to see us for an elective surgery, that morning you'll be screened by someone from the staff, temperature checked, questions asked. If you are safe from that point, you'll be provided a mask, and then you'll be brought into the facility. Everyone who's in the facility is also wearing a mask so that we're all protected from the coronavirus. So if you previously had labs drawn for an elective surgery and it was canceled, most likely those are going to have to be repeated because they won't be within the 4-week time frame we usually use. So an updated lab panel will most likely be performed. That will be performed prior to surgery, just like you had from your first pre-op visit, and someone from the office will call you to schedule that. Right now, for elective surgeries, actually for any patient admitted to the hospital, the patient alone will be admitted in. The family members are not allowed into the facility. This keeps with the social distancing program that we've been following. Your contact information as a family member will be taken down, and then as your family member goes through the process, you'll be contacted appropriately at different times before surgery, during surgery, after surgery. And if your family member is admitted to the hospital, we even have a way to do FaceTime so that you can see your loved one even if you can't be in the building. Following surgery, the prescription for the patient will be sent to the pharmacy electronically, and it can be picked up later that day. Alternatively, the prescription could be put in that morning prior to the procedure, and the family member could pick it up while the procedure is being performed and then pick up their loved one once they're done. Walter Reed Hospital is the cleanest it's ever been. We have a brand new facility that was just put together. We started it about a year ago. We have 2 separate locations for patients. Surgical patients are in one section, medical patients in another. Patients who may have the coronavirus are in a totally separated section so that there are separations between different locations within the facility. In addition to that, environmental services, we have had people come through and clean all of the hard surfaces with something that kills coronavirus in addition to other pathogens that could be in the building. I couldn't be in a safer place to operate than at Walter Reed. So following your procedure, we want to make sure that you are safe and comfortable at your home. Because there are a lot of things moving right now, we've changed talking to you in person. Your family member cannot come in. We only talk to the patient. We have made ourselves more available than prior using electronic media, specifically Riverside MyChart. And I would encourage my patients to have an account on the MyChart because you can upload pictures, you can ask questions, you can contact our nurses. We also have standard telephone. We are working on virtual. okay, so that you can video in and talk to your surgeon or staff. In addition, surgeons are available for questions 24/7 through the call system. What we want more than anything is that you have a safe procedure and a safe recovery.